Okay. My name is Brad Leibovich. For those I haven't met, it's nice to meet you. I happen to have the honor to serve as the chair of the board of directors of the Kidney Cancer Association, so I'm going to take advantage of my few moments at the podium to thank you all for coming, to congratulate the meeting planners and the committee for doing a phenomenal job, and to thank all of our sponsors. It's always a bittersweet honor and pleasure to introduce somebody in honor of Chris Wood, who was a good friend of many of us here in the room. For those of you that didn't get to know Chris, Chris went to Purdue for his undergraduate degree, got his MD at Northwestern, did general surgery at Northwestern, urology at Northwestern, went to MD Anderson for urologic oncology and never looked back. He was the vice chair of MD Anderson, Department of Urology. He had endowed professorship, and he was the chair of the board of directors of this organization, and led us to where we are today, and along with Gretchen, righted the ship of the KCA, and I think we owe him a debt of gratitude for that. Chris had many honors and awards throughout his career. I'm not going to go through these. What was really wonderful about Chris was his gratitude for his relationships, his generosity to those people that he had relationships with, his generosity of his time and friendship. He was an unbelievable educator and mentor to innumerable people, which is why it's very fitting that we have an award for Rising Stars in Urology named for Chris. So now I'm going to introduce Dr. Braun. So Dr. Braun is an assistant professor of medicine, medical oncology, and a member of the Center of Molecular and Cellular Oncology at Yale Cancer Center. He focuses his efforts on improving the care of patients with kidney cancers in every domain. He received his bachelor degree in molecular biology from Princeton, and then a PhD in computational biology. After that, he got his MD at Mount Sinai, did internal medicine residency at Brigham and Women's, and then he did his medical oncology fellowship at Dana-Farber. This is an eye chart. I don't expect you to be able to read this. These are Dr. Braun's honors and awards, which I don't have time to go through. But for somebody who I would consider to be still very young, it's an extremely impressive list. Dr. Braun then moved to Yale from Dana-Farber, where he was an instructor in medicine. And he has a clinical and scientific interest in understanding and improving immune therapy for kidney cancer. He's not only an assistant professor of medicine, but has joint appointments in urology and pathology. And if you look at his CV, you can see he's truly a connector and collaborator with many people. He is a clinical trialist. He has had significant research funding, including a grant from the KCA. He's widely published. He's an incredibly sought-after speaker. I don't know how he gives so much time to so many different organizations. And he himself is already a phenomenal mentor to the next generation of rising stars. He augments his own work at Yale by fostering and mentoring physician scientists as they advance their laboratory-based research programs, and helps them with clinical investigation and translation of basic science discoveries into better treatments and better diagnosis. So in summary, I think Dr. Braun is a rising star in every domain. I'm really looking forward to you hearing from him, and please join me in congratulating him for this award.
So that was the hardest part, was actually taking the photo. But no, thank you so incredibly much. This is a tremendous honor, and I'm incredibly grateful. Yeah, I wanted to start off also first saying a few words about Dr. Wood. And, I didn't have a chance to know him personally. I got to see him from the audience, actually at KCA meetings in the past. And so I went to some people who know him well, and things like he's a force of nature, he's larger than life, he's a legend. But there's someone I work really closely with at Yale, who's one of his former fellows, Pat Kenny. And so I talked with Pat fairly extensively at just what sort of made him special. And he really broke it down to a few big domains. In the clinic, he was obviously this prolific surgeon, but he was bold. He was willing to take risks if that made sense for the patients. And he really put the patients first. He had so many patients because he was such a prolific surgeon, but really connected with each one of them. And that's something that I think is such an important aspect. On the research front, he was really a creative and out-of-the-box thinker, but his research endeavors really were informed by his patients, what he saw in the clinic. And that idea of being informed by the patient is also something that I, in even small fractional ways, sort of try to emulate. And then finally, he, as a person outside of the clinic, he was really just beloved by all those around him. He truly cared, not just about his patients, but about staff members, his fellows, really all of those around him. He really cared. And so those are domains where, again, if I can live up to any small fractional amount in any of those domains, I'd be very grateful. So I don't particularly love talking about myself, but on the other hand, I like talking about science. I like talking about the people around me, and I particularly like talking about my homeland, my home country of Canada. So I will, for the next few minutes, either bore or entertain you with a little bit of my background, kind of going through where I got where I am, largely focused on the people around me. And I see there's at least some Canadians in the audience. I see Dr. Vincent Hsu here, so you can fact check me. I'm sure what I'm about to say is completely accurate, but just in case, you are welcome to fact check me. So I'm from Canada originally. I'm from Toronto. For those who don't know, that's where it is. Now, those from the States often regard this as America's hat. But I don't want you to be worried. I think that as Canadians, we often think of America as Canada's pants. But, there's a lot about Canada you might not know. You might know our money has these very bright colors, which is wonderful. I'm actually very grateful you have incorporated this currency into your popular board game Monopoly, which has been really nice. But we're known for much beyond our currency. We're known for our rugged sportsmanship, our high fashion, and certainly our fine cuisine within Canada. So really, a remarkable country. That's poutine for those who haven't tried it. It's the key is to put the gravy on afterwards. And so I grew up in Canada, but was really lucky to be in an amazing and loving family. Both my sets of grandparents had survived the Holocaust. My own parents had survived oppression under communism and had come over in the 50s and really, instilled a sense of resiliency, of the importance of education and importance of sort of caring about those around you. So with my family, my brother Daniel was incredibly well supported growing up in Toronto. And so I made the leap over to Princeton, where I really got my first exposure to research. I came in not necessarily knowing what I'd want to do. So I was interested in computer science, I was interested in biology, and it was really Ron Weiss, who's now at MIT, who really introduced this idea to me that you might be able to do both, that you can really apply quantitative principles that engineers or computer scientists might do, and try to actually apply that to gain some sort of biological understanding. After that, I moved slightly north to Mount Sinai and NYU. This was a brief period of time where they got along. And it was Stuart Sealfond, who was my PhD mentor, who really gave me the first introduction to how to do systematic research, how to become comfortable with a new field, learn open, important questions, but ones that are feasible, really come up with an actual research plan and implement that. And it's very different from what I do today. This was, largely research focused around decoding cytokine signaling, but that idea of integrating both computational approaches and experimental approaches are certainly something I carry with me today. And the other part I certainly carry with me is the way he sort of modeled how to interact with graduate students. He met with me every single week, went over everything from big picture ideas all the way to granular flow cytometry plots. And that idea of supporting graduate students in big ways and small ways, that was something I very much try to live up to in my own laboratory. Certainly made a lot of good friends and family members along the way, so really lifelong friends at Mount Sinai and NYU, and I was fortunate enough to meet another medical student, Lori, who we met our first year of med school and got married towards the end of medical school, and has really been my supporter and my enabler this whole time. It was also a difficult time. My mother had unfortunately been diagnosed with metastatic carcinoid cancer and had passed away during that time. And, she'd always struck me as a sort of incredibly, just sort of superhumanly kind person. But it was really kind of her selflessness that stuck with me sort of throughout the years. I remember after she had passed away, she'd been involved with a carcinoid patient advocacy group in Canada. It's not a very big community. And so I was talking to some of the other members, and they all, one after another, said that whenever she'd go to these meetings, doesn't matter what treatment she was going through, the only thing she would talk about is other people. How were they feeling? How was their family members? It was a sort of really true selflessness that practiced the way she preached that I really do my best to live up to. So after that, made my way a little bit further north to Boston and had tremendous mentors in residency there, made lifelong friends, key people in the residency, Marshall Wolf and Joel Katz and Becky Barron and Maria Lamas, who eventually led me to Kathy Wu. And Kathy really, for me, laid a lot of the foundation for the research that we do today, how to utilize cutting-edge genomics approaches, single-cell approaches, but also root that in sort of fundamental immunology principles. And that's something that has really formed the foundation of my own laboratory. And so I moved on to fellowship, ultimately pursue research. And it was there, I truthfully wasn't thinking about kidney cancer at all coming in. I'd never really been exposed to it. But I think, like many things in life, there's a lot of serendipity that sort of plays a role. So certainly I had an interest in cancer immunotherapies, this idea that you could not just treat a metastatic cancer, but actually induce long-term and durable responses was something that was incredible. And at the time, this was around 2015 or so, was really hitting its inflection point. But the things you can't control are people you meet along the way. And as a first-year fellow, I was assigned to my thoracic clinic and my GI clinic. And for my GU clinic, I was assigned to this very full of energy, full of life gentleman who certainly don't, I think, to many in the kidney cancer field, Tony Shawarian. And Tony really became not just a mentor and certainly taught me clinical kidney cancer and how to think about translational things, but really he's someone who embodied taking a true interest in me as a person, me, my family, and he's someone who is really, I view as a member of the family now, that he is someone who has really tremendously supported me in every domain throughout. So that was something I wasn't expecting. That was a bit of serendipity. But it's also the experiences that I see along the way. And a lot of those experiences were patients, honestly, during my first year. And I have these two sort of patients that were really burned into my memory of really sort of opposing responses. Essentially, these were two patients with kidney cancer. They got similar treatments ultimately, got immune therapy-based treatments. Both young patients. One patient did incredibly well, had a complete response. Another patient, a young woman in her 30s in technology, unfortunately passed away very, very quickly in a very difficult way, obviously, for her and her family. And really driving questions of, why did patient one do so incredibly well and why did patient two not? And that's really what has formed the foundation for a lot of what, for the next decade, we have sort of worked on to try to sort of tease apart. And so within Kathy's lab, we really start to try to approach these questions using genomic approaches, using single-cell approaches, really to try to tease out the determinants of response. But along the way, definitely had a huge amount of support from my family as well. So we had two kids during my fellowship years and junior faculty years, and then ultimately just a few years ago moved to Yale. And there I met a whole new set of colleagues and mentors: Pat Kenny, Mario Snoll, Harry Kluger, Marcus Bosenberg, Mike Hurwitz, David Schoenfeld, who's here as a brilliant assistant professor. And is here where I really start to build my laboratory, and this has been an incredibly rewarding experience. When I was looking around for different places, I wanted to go to a place where I would sort of be the dumbest person in the room. Turned out that was a pretty low bar. Lots of places met that metric, but being at Yale with this group of graduate students, PhDs, postdocs, undergrads, it really has been a special experience. And along the way, we now have a third daughter, Ellie, along with Abby and Julie, and they've continued to grow and sort of support me along the way. So with that, I'd like to thank the KCA for their tremendous support, thank my mentors, friends, teachers, the patients who have taught me along the way, my family members, and most of all, my wife, Lori, who really has made this all possible. But thank you so much.